Can I get pregnant if I have PCOS? This is the most common question which every young woman who's planning a pregnancy and has PCOS asks me. So the answer to this question is a very much yes. Just because you have PCOS does not mean that you can't get pregnant. PCOS is one of the very common causes of infertility, but a treatable cause of infertility. It just means that you probably might need a little more assistance, there might be a little delay, but it is definitely possible. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So continuing with our infertility series, today I will be taking some commonly asked questions about PCOS and infertility. At Maitri, in our PCOS series, we've done more than 15 videos covering a lot of topics. You can watch all of them. Can I conceive with PCOS? Yes, very much. Every woman with right lifestyle changes and the appropriate medical assistance can definitely get pregnant. Why is it difficult for a woman to conceive with PCOS? So you need a healthy egg, the right timing and a perfect hormonal atmosphere for the fertilized egg to implant. Now in women with PCOS, there could be anovulation, which means no ovulation, or it could be delayed, irregular or erratic. So it becomes very difficult to time the sex according to the fertile days of the cycle when the ovulation is happening. Also, it may become very difficult in case the ovulation is happening maybe once in 3 or 4 months. Women with PCOS also have higher implantation failures because of the problems with the endometrial preparation, the endometrial receptivity and the entire hormonal atmosphere around the fertilized egg implantation. How can I track my ovulation if I have PCOS? Now this is the most tricky part, especially if your periods are irregular. First is try and track your cycles. So let's say if you have a cycle of 45 days, maybe 50 days or 60 days, but regular cycles, you can just subtract 14 days from the date of the expected periods and that's your fertile day. Second is, in case your cycles are absolutely irregular, you can try and observe for the natural changes in the body. Ovulation happening, the cervical mucus becomes very thin and very stretchy, so much so that you can actually stretch it like this. Just before the ovulation, you might have a little pain in the lower abdomen, which is known as Mittelsmers. And also, you could notice some tenderness in your breast just before the ovulation. You could also see a slight rise in the body temperature in case you are tracking your body temperature on a BBT thermometer. Third, you can also take help of the ovulation testing kits. So you could start using the ovulation testing kits 3 or 4 days before the expected date of ovulation. I understand when someone has irregular periods, you really do not know when to start testing on the ovulation testing kit. So in the first cycle, maybe in the second cycle also, you may need to use 2 or 3 kits, and also you might take about 2 or 3 cycles to get an idea of how your cycles are behaving. Fourth, you definitely can take a help of the follicular study or the ovulation studies which are done on the ultrasounds to track the growth of the follicle. Can I conceive naturally if I have PCOS, or will I definitely have to take a medication? You definitely can conceive naturally without the help of medications also when you have PCOS. Following strategies would help. Number 1, reducing your weight. Number 2, exercising adequately. Remember, the exercise has to be a sustainable exercise, a moderate exercise. Excessive exercise is actually counterproductive. Making sure that you eat a clean, healthy, wholesome diet. There is a great evidence which says that plant-based diets help in PCOD. Make sure that you're eating fresh diet and you're eating according to circadian rhythm. Make sure that you sleep well and you avoid stress in your life. And in case you are planning a baby, try and have sex every day around the time of expected ovulation. Is there any special food which will help me conceive easily? So remember, there are no magical foods to do this job. Remember, fad diets are bad diets. Let no one fool you with the kind of PCOS teas or herbs or bars or anything. Just try and have basic seasonal fruits and vegetables, fresh diet. Remember, all these things are rich in antioxidants, rich in fiber. They reduce the inflammation in the body. Avoid trans fats, processed and packaged foods. So remember, there is no single food which can make you achieve that pregnancy fast. Should I treat my PCOS first and then plan a pregnancy? Not really. But it is important to be in the best of your health, like controlling your weight, your sugars, your thyroid, your blood pressure before you get pregnant, so that you have an uncomplicated pregnancy. But in case you happen to conceive during the course of treatment of PCOD, it's absolutely fine and things can be managed very well. What is the best age to have pregnancy if I have PCOS? So PCOS or no PCOS, the chances of easy conception and smooth pregnancy decline as the age goes up. With the age, the quality of the eggs and the number of eggs deteriorate. The chances of medical complications like diabetes, blood pressure also increases in pregnancy. So plan early. How do I know that I have conceived? As it is, I have irregular and delayed periods. Now, once again, this could be little trickier. So in case you have missed a period and you are trying for pregnancy, please do a pregnancy test. You might have to do frequent pregnancy tests even if your earlier tests are negative. In case you are suspecting it, you could do a blood test of pregnancy called beta HCG also. It's important to detect the pregnancy at the earliest so that the pregnancy care can be started early. Also, if you notice some funny taste, funny smells, nausea, vomiting, changes in your breast, it could be a sign of a pregnancy. Are there more chances of twins if I have PCOS? Not really. Many patients with PCOS require ovulation induction, which means that we artificially try and induce ovulation. So in such cases, there are increased chances of multiple pregnancy, but per se, PCOS does not increase the chances of twins. Are there more chances of miscarriages if I have PCOS? Sadly, yes. So women with PCOS are 3 times more likely to miscarry as compared to women who do not have PCOS. So it is the abnormal hormonal atmosphere, high LH levels, high testosterone level, abnormal insulin resistance, obesity, pre-diabetic state, endometrial dysfunction, they all contribute to increased chances of miscarriages. So plan well, prepare well and prevent complications. Will my pregnancy be complicated if I have PCOS? So women who have PCOS in pregnancy have a higher chance of gestational diabetes, high blood pressure, preterm deliveries, intrauterine growth retardations, meconium staining liquor, which means that the baby poops inside. But it is important that you get the right kind of treatment, follow the doctor's advice, go for the regular tests, monitoring. Following a healthy diet and keeping yourself active also can prevent a lot of these complications. Will I need IVF to become pregnant if I have PCOS? Not really. Most of the patients do well with the lifestyle changes. Some patients might require certain drugs to increase the ovulation rates. Very few patients who have resistant severe forms of PCOS might require IVF. So not every complicated situation in life has to have a complicated solution only. So most of the patients with PCOS with the right kind of lifestyle changes and little bit of medical assistance can get pregnant. You just need to be patient, following the right things and following the doctor's advice. So today, if you found this information useful, do not forget to like, share and subscribe to Maitri. You can also subscribe to Maitri right now by clicking the icon at the right lower end of the video. And for more detailed information, you can also log on to maitriwoman.com. Maitriwoman.com is live now. So stay safe, stay healthy, and I will see you soon.